Imagine yourself waking up feeling very tired. The first thing you think about is a cup of coffee to get you on foot. But how does it actually work? In today's video, I'm going to do a simple overview of nootropics, also known as smart drugs. Smart drugs are substances that enhance cognitive function, memory, creativity, motivation, or focus. These drugs can be prescription medications or over-the-counter supplements. Their mechanisms of action can vary widely and their efficacy can differ from person to person. Later into the video, you will learn how these substances work, the benefits they may provide, and the potential risks associated with their use. Neurotransmitters are chemical messengers in the brain that influence many aspects of mental function. Several smart drugs target neurotransmitter systems to enhance cognitive performance. Dopamine and norepinephrine. Drugs like Ritalin, methylphenidate, and Adderall, amphetamine, increase the availability of dopamine and norepinephrine by blocking their reuptake or increasing their release. This action can enhance focus, motivation, and alertness, making these drugs popular for managing attention deficit hyperactivity disorder, ADHD, and for off-label use in healthy individuals seeking cognitive enhancement. Acetylcholine. Nootropics, such as piracetam, enhance the activity of acetylcholine, a neurotransmitter vital for learning and memory. It benefits in improved memory formation and retrieval, as well as enhanced overall cognitive function. Certain nootropics enhance cerebral circulation, leading to increased blood flow and oxygen delivery to the brain. Ginkgo biloba. This herbal supplement may improve blood flow and reduce blood viscosity. It benefits in enhanced cognitive function, improved memory, and possibly delayed cognitive decline in aging individuals. Vinpocetine. It is believed to dilate blood vessels and improve circulation. It benefits in improved memory, attention, and overall cognitive function, particularly in individuals with age-related cognitive decline. Neuroprotective agents help safeguard brain cells against damage and inflammation. Bacopa monnieri. This herb is rich in antioxidants that protect brain cells from oxidative stress, improve memory and learning, as well as reduced anxiety and stress. Lion's mane mushroom promotes nerve growth factor NGF synthesis, which is essential for the growth and maintenance of neurons. Potential improvement in cognitive function, mood, and memory. Certain nootropics may enhance the brain's energy metabolism. Creatine. This compound increases the availability of ATP, adenosine triphosphate, the primary energy currency of cells. It benefits in enhanced mental endurance and cognitive performance, especially during intense mental tasks. Coenzyme Q10 functions as an antioxidant and is involved in the energy production process within mitochondria. May improve energy levels and cognitive function, particularly in older adults. Neuroplasticity is the brain's ability to adapt and reorganize itself, while neurogenesis refers to the formation of new neurons. BDNF, brain-derived neurotrophic factor. Some nootropics are believed to increase BDNF levels, supporting the growth and survival of neurons, enhanced learning, memory, and cognitive resilience against age-related decline. Omega-3 fatty acids. Found in fish oil, omega-3s are associated with brain health and neuroplasticity. It benefits in improved mood, cognition, and possibly a protective effect against neurodegenerative diseases. Certain substances can enhance alertness and reduce the perception of fatigue. Caffeine. Caffeine blocks adenosine receptors, which helps delay the feeling of fatigue. Increased alertness, improved focus, and enhanced physical performance. L-theanine. Often found in tea, it promotes relaxation without drowsiness, can enhance the effects of caffeine while reducing potential jitteriness, promoting a focused yet calm state of mind. While some nootropics are generally regarded as safe, there are significant risks associated with their use, especially when it comes to prescription medications. Side effects. Prescription smart drugs can cause side effects like anxiety, insomnia, increased heart rate, and potential addiction or dependency. Over the counter supplements may also have adverse effects, particularly if taken in high doses or in combination with other substances. Individual variability. The effectiveness of nootropics can vary significantly between individuals. Factors such as genetics, health status, and concurrent medications can influence how one responds to a nootropic. Lack of regulation. Many over-the-counter nootropic supplements are not well regulated, leading to variability in product quality and ingredient purity. Ethical considerations. The use of smart drugs raises ethical questions, especially in academic and professional settings. Issues around fairness, pressure to perform, and long-term effects on health must be considered. Consultation with healthcare providers. It's essential to consult a healthcare provider before starting any smart drug regimen, particularly for prescription medications or if there are underlying health concerns. Conclusion. Smart drugs and nootropics can offer potential cognitive benefits, but it is crucial to approach their use with caution. Understanding their mechanisms, benefits, and risks is essential for making informed decisions. As research continues to evolve, our understanding of these substances will deepen, paving the way for safer and more effective cognitive enhancement strategies.